South Africa has called on countries that have implemented travel bans to immediately reverse them. Voyagers from the country have borne the brunt of travel bans imposed by a number of countries around the world as a result of the discovery of the Omicron coronavirus variant in South Africa. This morning, here is the question we're posing. Is South Africa being punished and unfairly treated for sounding the alarm on the new Omicron coronavirus variant? To discuss this, we're joined by health activist Dr. Kgosi Letlape. A very good morning to you, Dr. Letlape. Thanks for making the time.
Good morning to you and to the viewers of SABC.
What's your take on how the international community has handled South Africa's detection of the new Omicron variant?
I think a lot of pundits have described it as an overreaction from the UK. And what we need is a standard protocol globally in terms of what to do. It's quite surprising that we currently have low infection rates in the country, and the UK is having over 50,000 daily infections. And you wonder what is it that they are protecting, because the reaction that they have taken is not one backed by science. These are political decisions and decisions of convenience. But we should not be surprised that the UK has acted in this manner.
Interesting one. Standard protocols required, you say, but based on how the situation has unfolded, which parallels should be drawn from the treatment of how South Africa was treated during the advent of the Beta variant and now the Omicron variant?
I think they've done the same thing that they did during the Beta variant, and I'm not sure why we were expecting them to behave differently. I think there's some questions that need to be asked. The fact that we have scientists that are prepared to volunteer information in the interest of public safety to the world is something that should continue. What we need to mitigate against is how they react and how we react to it. I'm not surprised at what the UK has done, given what they've done with Beta. I'm just surprised that we are surprised, that our officials are surprised. And what we should be doing is, when we have this information that we give to the world, what is the next line of action? And what is becoming clearly abundant is that bans do not work. We need a rational approach, and we need to now devise strategies of living with the virus. You know, whether you are screening your own citizens or foreigners that come in, the screening is the same, and the criteria should be the same. I mean, the UK has been known to discriminate, particularly against those that are in the Commonwealth, because of a superiority complex. So they will always discriminate. It doesn't make sense that if you're a UK citizen in South Africa, you can come back, and if you are a South African citizen, you can't travel. We need to get to normative standards that travelers need to meet to travel, whether they are locals or they are foreigners. If we're going to say you must be vaccinated, you must be COVID negative, we need to be able to trace, you must report if you have health symptoms. Let those be the standard protocols that all nations observe at their borders.
Dr. Letlape, there are quarters that believe that scientists should have held on and waited to have conversations with the president and allow the president to make this announcement following engagements. What are your thoughts about this assertion?
I do not agree with that assertion. What we should be doing globally is to separate the politics from the science and from the medicine. And we must have health authorities speaking to health authorities. We must have our health officials and scientists speaking to the World Health Organization. And they should be the ones that give the briefings to the politicians. What we need to do is to depoliticize coronavirus. And that will help us deal with vaccine hesitancy and many other issues. Let health matters be dealt with by the health professionals and the health scientists and the relevant bodies like the NICD in our country and the relevant body in the UK.
My next question picks up a bit on what you've already said, but how much of a stretch is it, as some people have suggested, that the reaction by the international community to the discovery of Omicron amounts to Afrophobia?
I think there is evidence for that. If you look at it, at the time that the announcement was made, South Africa was not the only country where this variant had been identified. It had been identified in far-flung places like Hong Kong. And you had other African countries like Botswana. But when you listen to the Botswana story, the Omicron was imported by diplomats into Botswana. And then after you do your job of proper screening, proper detection, serotyping, you then get penalized for that. Yes, there is Afrophobia. If you were concerned about this, why would you not say any nation where this has been identified, do not come in? I'm also quite surprised, and I will not be surprised to find that the UK people have Omicron, but they have not announced it to the world. And they are now looking for scapegoats for their own roaring pandemic, where they have a high number of people vaccinated, but they've abandoned non-pharmaceutical methods. And that is why their numbers keep rising. And I think the thing to learn for us is that this is not an either-or situation.
Yeah.
It's not, let's vaccinate everybody so that we can ignore simple public health principles. It's doing both together and ensuring that we avoid gatherings. And we must be cautious and extremely cautious, given our history about how we approach the sensitive subject of vaccine mandates.
Of course, that conversation about vaccine mandates is coming up now following that address by the president last night. But just in terms of medical ethics, how ethical do you think South African scientists acted in announcing the detection of Omicron before we knew much about it and its behavior?
But I just have certain concerns where we tend to veer into territory of unknowns. And that is where we scare people. It was correct to come out to say we've identified this B11529 variant, which has now been named Omicron. But it was possibly reckless to begin speculating about its possible effects on vaccines and its possible effects on infection rate and severity of disease when we do not have the evidence. What I would have said is that those matters will be looked at and investigated, and we will report accordingly. Not express an opinion on a matter that is not backed by science. Remember, once we start opining, it means there is no evidence, there is no science, because otherwise we would be presenting the science and the facts.
Which is the way we should be going. So, Dr. Letlape, how prepared are we as South Africa to fight the Omicron variant?
I think we still have the challenge of two worlds in South Africa. If you were to bisect the haves and the have-nots in South Africa, you'll find that vaccine penetration amongst the haves is quite high. But since we have two worlds in one, we have not come to grips with how to manage both equitably. There's still a lot of people that don't have easy access to vaccines. Those that are employed, those that are on Medicaid, those that are in the corporate world, those that are in urban centers have better access. But those that are in rural areas, those that are in townships, access can still be improved. We could still recruit traditional healers into educating about COVID to deal with vaccine hesitancy, just like we did when we were educating about HIV. We could recruit all healthcare professional independent practices, including and in particular the GPs that we have, turn them into vaccine sites. It will create more confidence in the public. It will improve access. But more importantly, the people would have the assurance that if I'm vaccinating with my local doctor, if I have a reaction or if I have consent, I don't have to deal with the website or phone. I just go to the person that I trust with my healthcare, and they will be able to help me, hold my hand, and guide me. and
Yeah.
would be able to increase vaccine rates and deal decisively with hesitancy.
Dr. Letlape, just a quick one. We're heading towards World AIDS Day. Just your thoughts about the government's announcements last week that they want to incorporate all the efforts together towards HIV/AIDS, TB, and coronavirus.
I think it is the right thing to do, to have a comprehensive approach to health issues. But what we need to highlight, in particular with HIV and AIDS, is that our prevention efforts have stalled. They never really came out of the starting blocks. And we need to be mindful of the fact that our social norms fuel the epidemic. It is still affecting younger women and our young adults. And there's very, very little effort in terms of prevention of HIV. HIV is a personally acquired infection, and we need as much vigor about its prevention as we show about preventing COVID-19.
Dr. Letlape, thank you so much for your time this morning.
Thank you for the opportunity.